With hair loss, again, it's a continuous process of losing your hair. That's shedding, and people don't like it a bit. With the OXO SMT technology, all 4 milliwatts are going to treat hair loss.
So I'm here with world famous Dr. Robert Leonard, a friend of mine. We've known each other for at least 20 years, and he is really an icon in the industry when it comes to hair transplantation, hair loss, how to prevent hair loss, how to treat hair loss. He's also my physician. I actually had my hair transplant done by Dr. Leonard many years ago, and now trying to keep what I have and to make it thicker and stronger. So we're here today to talk about a new device called OXO. So Dr. Leonard, let us know a little bit about who you are, how long you've been doing this. I kind of already mentioned that, as well as how you got involved with OXO.
Great. So hi, I'm Dr. Bob Leonard. I've been a hair restoration surgeon for over 35 years, and I'm the director of the Hair Health Institute for the last 23 years. And the goal of the Hair Health Institute is to provide appropriate medical therapies to stabilize progression of male and female pattern hair loss and to regrow hair in a non-surgical way. So the OXO A300 is the first device of its kind that has SMT technology, which means surface mount technology, which provides a laser beam that is deeper and wider than any other device on the market. And Dr. Lowney has had hair transplantation, obviously. Those hairs will stay forever, but the non-transplanted hairs in his head will continue to miniaturize and thin out. And using laser therapy, it's also called photobiomodulation, that will stop that progression in 90% of patients, a big number, and will actually regrow the small miniaturized hairs back into thick hairs. So that's why it's a great option for people who have even had transplants to stabilize progression.
So there are many different devices out there that are similar to this, and if you can, Dr. Leonard, just kind of explain to us how this is different and how it is more efficacious.
Sure, so I'm going to hold the OXO A300. It's extraordinarily flexible, so it's very, very flexible and very difficult to damage. There are 300 laser diodes, but again, they're surface mount technology where they are not soldered together. All the other devices with the old type of diode are soldered together. And people say, what's the big deal about that? Well, the big deal is that there's no resistance of energy that's taken up by the metal and the solder. All of the energy is going to the actual diode. So in other devices, it's been shown that instead of having 4 milliwatts for each and every diode, it goes down to 1.2 or 1.8 or 3.7. So the energy, the total energy going to treat hair loss is diminished. With the OXO SMT technology, all 4 milliwatts are going to treat hair loss. Because the shape of the device is deeper, so they're deeper going on the sides and the back, people can wear it and get treatment. A lot of women have thinning hair along the sides as well as the top. They're able to get a lot of more treatment area covered as well as the back of the head. So that's another big benefit of having this device compared to others on the marketplace.
All right, so here I am, and I'm wearing this, and first of all, it fits. I have a fat head, and it fits pretty good. Very comfortable. I don't feel any heat. I can't actually see the laser, so I don't have to wear any kind of protective eyewear because it's not in my eyes. So a little bit about protocol. How do you recommend patients use this?
So the OXO A300 is worn every single day for only 10 minutes. So the time it takes to drink a cup of coffee, the therapy's done. So what's important to know when you first get the device is that you have to charge it for 24 hours, unplug it from the wall, put it on, turn it on, and wear it for 10 minutes. It will beep. 2 beeps mean 10 minutes is up, and that's the end of the therapy. What's really important to learn about hair loss, or to understand about hair loss, is that it takes a long time to lose your hair, and it takes a long time to get it back. So the hair growth cycle is a 3 to 4 month minimum time frame before we would see any results. So I told Dr. Lowney this, he already knew it when he had his transplant, but you won't see any change in your hair shedding for about month 4. If you see hair in the drain, you see hair in your brush, that'll be the same for the first 4 months of using laser therapy. However, after that point, it will slow down tremendously to almost nothing, in fact. And it takes about a year to see regrowth of the small hairs growing back into longer hair. So, patients have to be patient. Doctors are not the most patient people in general, I will tell you. We have to be patient. It takes time to get the results. So that's important to know.
10 minutes a day, every day? Do you take a day off or just do every day?
No, 10 minutes a day.
Every day. Both men and women can use this.
Definitely.
Okay. There's no different settings. It's the same setting. 4 to 6 months to almost a year before you're going to see results. Now, you had told me some statistics regarding hair, maintaining hair versus growing new hair.
Right.
Could you just share that?
Sure. So with hair loss, again, it's a continuous process of losing your hair. That's shedding, and people don't like it a bit. So what low-level laser therapy or photobiomodulation does, it stabilizes that loss in 90% of patients. You compare that to other medical treatments for hair loss, other FDA cleared approved things, it doesn't come close. So 90% of people all over the head will stop shedding, and 60% of people regrow their hair. It's really a quite wonderful treatment for hair loss. It is.
Excellent.
So one of the important things to do is to track progress. So we take before pictures on all patients, straight on, head down.
I'm going to share these with the folks so you could track my progress
And
too.
then from one side and the other side. And it's great. And then all the way down. Perfect. So we have a documentation of the pre-treatment now, and we'll be able to follow this, but again, it won't be for 6 months before we even see a hint of regrowth. 12 to 18 months is when everything's fully grown in.
So other recommendations for patients that are losing hair, their hair is thinning, in terms of supplements, is there any food substances that you could eat, any vitamins you could take that have been shown to help?
Yeah, there's some vitamins that have been shown to help, but I mean, it's a kind of an iffy science sometimes, but selenium and zinc are very good for hair.
Okay.
And for hair growth. I have a line of hair care products called Copper Chemist, which is all natural-based products.
Okay.
And the copper peptides, it's a natural occurring substance that will actually help stop progression of hair loss. Most shampoos and conditioners, hair care products, they make your hair that's already grown out look thicker and fuller, but they really don't do a heck of a lot for stabilization of hair loss. Saw palmetto, which is a natural product as well, has been shown to be helpful with hair loss, but when you really do scientific studies, it doesn't do very much.
How about some of the over-the-counter now minoxidil foams, Rogaine, stuff like that?
Right.
What do you think about those products?
Sure. I think that the two FDA-approved medications for hair loss are effective. So we have minoxidil or Rogaine that's applied topically twice a day, every day. Today there's an off-label use of oral low-dose minoxidil that I find to be helpful, but that's off-label. And then Propecia or finasteride works very well, but only in the crown area, the back of the head. Propecia has some sexual side effects that I think are minimal, but nonetheless a lot of patients don't like it.
Sure.
The beauty of laser therapy is that there are no side effects at all.
How about PRP? Could you comment a little bit about platelet-rich plasma? We see it everywhere. It was originally used in dentistry. I use it now in my cosmetic surgery practice for scars. Also, they use orthopedic surgeons are using it for joint pain. And now the hair restoration docs are using it for hair restoration before transplant, after transplant.
And during transplant.
Yeah, so how does that work?
So PRP is not FDA approved or cleared, but because there aren't good studies yet. You know, it's a relatively new treatment for hair loss. It works mostly to generate growth of the miniaturized hairs. I've not found it to be particularly helpful at this point, at least, to slow down hair loss, but it can bolster up the growth of hair. It's done in many different protocols. That's the other problem, is that some doctors will inject it every 6 weeks for 4 times. Other people do it once every 6 months. There's no standardization. So it's something that's available out there, and it's something that people have to do long term. As with Propecia and Rogaine, you have to continually do those things in order to maintain results.
Awesome.